Communication. There are several layers of communication that are really important for people who have CVS, especially since CVS is often considered to be a type of invisible illness, and being episodic makes it even harder for other people to realize that there's something there going on that could come up at any time. So communication includes medication letters for school, proactive communication with about the condition in general with schools, workplace, coaches, and roommates. I think often it's important to talk with your team about the best time of when to talk to like an employer or a prospective school about your CVS, but it is helpful and important for people to know so that if you go into an episode and it affects these places, it's not the first time they're hearing about it after the fact. Proactive communication with nursing leadership at a local emergency department is also important if you have tended to need emergency department care in the past, and if you find yourself in a new place where you may need to go to a new or different ED. If you require emergency department treatment, then some tools in the toolbox for written communication to the ED staff can be helpful to refer to and have at hand in the time when you need it. So these things should include, ideally, an emergency department plan with written medication and IV fluid recommendations from your CVS team. If you don't have a CVS provider, then I would say consider taking a copy of the CVS guidelines with you and any medical records that you have showing your diagnosis and prior treatment to save time when you arrive. Also include a copy of your medicines diagnosis list, including other chronic medical conditions or history of side effects to medications and allergies that you've had. Let the emergency department team know right away that cyclic vomiting syndrome is what you have, whether or not it's similar to your prior episodes, and what medications or treatments that you've tried at home prior to arriving to the emergency department.